I got to think too, you guys have probably got to be the only nonprofit in the world who has a Twitch account. Do you guys still have that up and going?
We do. There's a bunch of them out there. Lots of places are figuring out. If you look right now, video games are bigger than the movie and the music industry combined in annual revenue. So the video game
Really?
industry is bigger than movies and music.
Oh, it's booming then.
Gaming in the hospital. Travis Eriksen from Child's Play Charity shows us how they help children in the hospital by using video games to make situations a little less stressful. So, let's do it.
Too many days in the darkness without a glimpse of the light. Running tired and broken and scared, but I swear I'll never give up the fight. I see you broken and beat, head pulled down over your eyes. Every part of you wants to surrender, but darling, you were meant to survive. With every star.
Travis, so nice to have you guys on. I am a huge gamer, and knowing that there's a nonprofit that specializes in video games, I mean, I just had to have you guys on. So if you wouldn't mind giving us a little backstory on you guys and really what your focus is, just to give people a better idea of your goals.
Yeah, thanks so much. Child's Play is really honored to be featured on the podcast and shared out with your audience as well. So, to give the background, Child's Play was founded in 2003. So we're coming up on the end of year 19, making plans for our 20th birthday, going into next year. But Child's Play was founded by Mike Verhulik and Jerry Holkins of Penny Arcade. And if you don't know Penny Arcade, it's a video game culture website. So they do comics, they talk about what's going on in the video game industry. And back in 2003, games, when they were in the news, if game companies or gamers were in, it's because games were bad and had no redeeming quality for society. And Mike and Jerry did not think that reflected them or their fans of Penny Arcade. And so after a local newspaper here in the Seattle area where we are, where Penny Arcade is based, they ran a story about video games where they literally called video games murder simulators and that they're teaching people to murder. Mike and Jerry went, we don't think that reflects us. We don't think that reflects our fans or our community. And so purely out of spite, they invited their fans to send toys in with the plan to make a donation to Seattle Children's Hospital and to give the news a positive story about something gamers did.
Yeah, you got to get the other side at that point.
Yeah, exactly, right? And so they worked with Amazon. Actually, if you've got a wish list now on Amazon that you send to your mom or your grandma for your birthday, you can thank Child's Play. We were one of the first lists and getting that program together and running, but created a wish list for Seattle Children's Hospital. There are cool pictures you can find online now of them making these deliveries. Trucks full. Their garage was so full they had to go get a storage unit to continue to store games and toys that were sent in. And when they made the delivery, the rec pool at Seattle Children's had been closed for some renovation and cleaning. And so there's this cool picture of them sitting on the edge of the pool with the pool itself full of all these toys that had been donated, and got the cool news story, got the hey, look at gamers did a good thing news story. But from there, looked at it and said, the fans have really spoke. We can't just do this one time. This was a stunt.
Yeah.
But the community really rose up. And so this has continued on now, 19 going on 20 years. And at this point, Child's Play is in nearly 200 children's hospitals all across the globe. We're in, all across the US. We're in England and Ireland. We're in Egypt and Australia and Kenya. We just added a hospital in Mongolia this year. So we're spread all over the globe. And the goal of Child's Play is to get games and technology into the hospitals, but also beyond that, to work with the staffs in these hospitals to help understand how games can be used as an intentional part of therapy and more than just a distraction.
That's awesome. So you guys are almost like the Santa Claus year round, bringing video games to everyone, right?
Yeah, it's pretty great. It's a pretty good gig.
Yeah, I love how you touched on it showing hospital staff how video games can be therapeutic almost, and stress relieving, because they really can. And I feel like what you brought up before of the video game starting off as being branded almost by like the media and outlets, saying that it's like what was the word,
Murder simulator.
murder simulator. Yeah, how it's sad that they were kind of branded that at first, because right now they're taking on a different realm, and it's all about how you use it, as long as it's in moderation and not in excess. And I'd love to get your thoughts on really just how important gaming is and the mental role it takes in helping children in stressful times, and how it affects their psyche and their cognitive ability, and how it affects them in that therapeutic way that you had said.
Yeah, so the way that we really got into this was Child's Play started doing some hospital visits, and what we noticed was the limiting factor. We were doing these visits at the end of 2015, moving into 2016, and going forward. And the limiting factor by that point was no longer access to games. When in 2003, when Child's Play started, hospitals were scratching together game systems, and they weren't very prevalent. But 13 years in, we had gotten a lot of systems and a lot of games and a lot of iPads into hospitals. So the department that Child's Play supports is the Child Life Department, and the real distinction of a children's hospital is that department. So both adult and children's hospitals have doctors who diagnose you and the nurses who treat you. But in a children's hospital, the Child Life Department is the department that is responsible for helping kids still be kids while they're there, along with keeping them on track with school and providing opportunities for play. Child Life is also teaching them about what a diagnosis means, what procedures are upcoming, all of those things at an age appropriate level for a kid, right? That's not what a doctor is trained in doing. A doctor is trained to understand what this cancer is and how to fight it.
That's very true.
But the Child Life specialists, they're trained in how to work with kids to teach them age appropriately, what do these things mean, what do the treatments look like, and just help them have a normal life while they're still in the hospital. And so our focus is supporting that department, and getting them games and technology was a good first step. But what we saw was, as soon as that became the non-limiting factor, the next hurdle that we needed to help them over was understanding how to use games. And so one of the first things that we put together was a therapeutic video game guide. And so it was a print guide at the time. Now it's online. You can find it at gametherapy.org. But the guide itself was helping break down the key components inside video games to help address different symptoms that kids are dealing with inside the hospital. So we break down short and long-term boredom, just to help them understand what are good games for waiting rooms and what are good games for the kid who's there for months on end. But we also look at games that can help address pain, games that can help address anxiety or sadness or cognitive impairments, and understanding how those games can be used intentionally. So the great example of a pair of games that people already know and love is Mario Kart.
I was just gonna say Mario Kart. It's got to be something.
Mario Kart and Mario Kart and Minecraft are it, right? And both are great games. Handed to any kid, they're gonna love playing them. But games that help address pain are games that give you something that we like to call cognitive overload. And I'm sure there's a better medical term for it, but we're not medical professionals. We're just helping in the space. So Mario Kart's a great example of a game that helps address pain and build that cognitive overload. There's a lot going on. There's fun music. You're dodging stuff. You're picking stuff up. You got to focus on driving, and your brain can get distracted and forget about the pain. It doesn't make the pain go away. It's not, a narcotic in that way, but it has that benefit of reducing perceived pain. And over time, it can actually last past the time that you're playing it. A game that works on anxiety is kind of exactly the opposite of Mario Kart, right? It needs to be a more chill game, very sandboxy, open world kind of stuff is great to help reduce anxiety, because you don't have that pressure building from the game of, I got to do this, I got to do that, I got to get there, I got to get to first place.
It's not a race.
Blue shell.
Yeah, it's not. You're probably on more like story mode almost in that, right?
Yeah. So like Minecraft creative mode, where a kid can just go build and do whatever they want, blow up their castle if they want, fight the zombies if they want, but if they don't want to, just build something neat, run around the world and explore. And so if you have a patient who is in the hospital waiting for a procedure and is anxious about this upcoming procedure, if you hand them Mario Kart or you hand them Minecraft, they're going to love it. It's great. Kids are going to love either of those games. But if you think and are a little bit more intentional and you give them that open world Minecraft, you give them that ability to have this game that can reduce that stress load. Where you give them Mario Kart, they're going to have a great time. They're not going to complain and be like, I'm anxious. I don't want to play Mario Kart. But Mario Kart's going to build that stress level unintentionally. And so our game guide was a tool we put together so that the child life staff and even parents and other caretakers can look at this and go, okay, kids are wanting to play games. Let me think about what games are appropriate to give them based on what they're dealing with at this time. And so the guide, along with having those broken down components for those different categories, has examples. And since we're not game publishers, we don't have games that we're favoring. We actually work with NPD, which is a video game research company, and worked with mental health professionals at UCSD to create a scoring rubric. So NPD looks at every game that comes out, and they're scoring them for, or ranking them for, lots of things that video game companies go tack them for and say, hey, we want to know more about this demographic. What games do they like? Or what is this game? Who should we market this game to? Or how do we market the key components in my game to this group? That's what their job is research in the game company, in the game space. But for us, they look at these key components on this rubric created by the partnership with the UCSD mental health professionals, and rank games based how they address those components or those symptoms that we're looking at. And we get a monthly update of, hey, here are new games. Here's what's good right now for the Xbox. Here's what's good for the PlayStation. Here's what's good for mobile and iOS games on all these different categories. And so we keep that gametherapy.org just updated monthly with that list as we get it from them.
I love the focus too on Mario Kart being a very good generic option too, because it's something too hospital staff and parents and siblings can also probably learn super quick. Like there's only a couple of controls. You don't have to use every single finger on both your hands and take a whole day in learning it and then still be bad. I mean, anybody can really just jump in 2 seconds, get that cognitive overload, forget about life and the stresses. And I'd love to just for the people hearing about the game guide for the first time, really go into a deep dive as to how important that game guide really is, and how if you don't necessarily work in a hospital or a hospital staff. I mean, if you're a parent with a child who's not in the hospital, this could also really, really do you well, because I guess it's simply like an entire guide for parents or hospital staff, people who have dependents, that actually just recommends video games that are more therapeutic based off what you said, the symptoms that the child is experiencing. And whether you're in a hospital or not, children all the time are experiencing stress, different anxieties that you might not know. And the very beginning, I love the table of contents that you have on the game guide, because it's so specific. It reads just like a curriculum. So it's 12 pages in total, and it reads kind of like a quick brochure. So for example, chapter 1 is called Pain. This chapter suggests video games to play that distract players from physical pain, which is what I think you were touching on before, or symptoms of chronic conditions. Then you go to chapter 2, it suggests video games that tackle boredom for short-term stays that are designed for waiting rooms, which actually I remember when I was younger being in a dentist office, and this was like the very first dentist office or public office that you would go into, and they would have video games. So it was an orthodontist, excuse me. So it was really good marketing, because they're the only ones with video games that I remember specifically trying to go to the orthodontist to play it. Kind of like,
I gotta get there.
Yeah, kind of like kids wanting to tell their parents, go to McDonald's, I want the Happy Meal, So I was good on that. I'm glad that it's starting to kind of take off too. And then chapter 3 tackles the opposite, tackles boredom, but in a long stay scenario, with games that provide more substantial entertainment for recurring patient recreation. We're probably, like we were chatting about before, Minecraft, maybe some story modes that are, longer, and people could kind of maybe come back to, hopefully with a memory card or so. And then Chapter 4, you guys tackle anxiety and hyperactivity, which what you also chatted before with suggesting video games that relieve discomfort and stress by calming players and promoting more of a peaceful mood, less on racing, I'm sure. And I'm probably actually gonna look at the games you guys suggest on chapter 4 for myself on that. Because that's good for everybody, man. I feel like everybody today needs a little bit of battling against anxiety and hyperactivity, because we're all just trying to move so fast. And that's definitely a good one. And then chapter 5, sadness. You guys tackle sadness by suggesting video games to improve mood and discourage negative thought patterns. And I gotta assume that these are the games given out during the harder, difficult stages of being in the hospital, I'm sure. Chapter 6, the last one, you suggest or you try to tackle cognitive impairment, meaning offering video games that offer low impact entertainment for medicated or cognitively inhibited patients. My question, out of those 6 chapters, have you found one chapter that is the most common, that children fall into the most, that those are the games that tend to have children gravitate towards the most? If I were a gambling man, if this was Vegas, I would say chapter 4 with the anxiety and hyperactivity, but get your thoughts.
It is, honestly, inside the hospital zone, they're using all 6 of these, and potentially using multiples with a child during their stay. But yeah, the one that a lot of people connect with is that anxiety level one. When we are at game conventions and we have kind of big posters of these that we put up, that anxiety one is the one that catches lots of people's eyes. And it's that conversation that is super easy with anybody who's played a game, to talk about how games can change the way that you're feeling.
Yeah.
Don't play a game if you don't identify yourself as a gamer, which most people are, even though they don't, because most people have something on their phone that they play. They've got their Farmville. They're doing Wordle. If you play Wordle, you're a gamer. Wordle's a game. That's what it is. Yep. Sure, it's on your phone. It's in a browser. Like, I didn't download a thing. I'm not using a controller, but Wordle is a game. And so you're a gamer. Surprise. Hey, maybe you just learned that on this podcast. But yeah, a lot of people who are not gamers don't make that connection about, oh, well, here's what I'm doing. But when you think about, playing Wordle, how it can just throw your emotions around when you've got that. You get the first 4, the last 4 letters of a word on your third guess, and it takes you, 3 more guesses to get whatever the first letter is, and you're like, oh man, I'm super frustrated. Oh no, that's not it. And then you get that last word and you get that feeling of like, yeah, I got it. There it is.
Yeah, I got it. It's like the equivalent of me hitting the shortcut on Koopa Troopa Beach in Mario Kart.
Yeah,
it's like,
exactly.
yes, got it.
And you could ride that emotional wave with Wordle. And if you get Wordle on that second word, that second guess, you get to walk around the rest of the day being like, man, I got Wordle twice. Like, boom, guess number 2. And so this helps connect this idea with people that games can really affect the way that you're feeling and change your mood. And so when you think about a kid who's in a hospital, who really, when they're there, there's not a lot of control available to that child. A kid at home has the opportunity to go pick and choose what they're doing, maybe go out with friends, do a sport after school, pick maybe what they're having for dinner that night. Mom, can we do this? Can we have that instead? Inside a hospital, a lot of control, almost all control, is taken away from a kid. The doctors are coming in saying, we got to do this. Nurses are saying it's time to poke you for that. Even the child life specialists who are there giving you opportunities for play and trying to help make life normal are telling you, hey, we're doing this. This is the time we could do this right now. And games give them that ability to have some control over what's going on in their life, pick something that's going to help them feel better, have the child life specialist come in. And part of the thing that we really feel strongly about this guide is it's all encompassing in the games that are listed, right? It's all the systems, it's all the different like age levels looking at this, because we think it's important for every kid. But being able to offer kids opportunities for, hey, here's some games. I know you're feeling down right now, but here's some games Like these are just fun. They're going to help address some of this sadness. So we feel really strongly about this guide being a great tool, not just in the hospital, but for people to use at home in their everyday life. And if you're a parent listening who's not a gamer and you don't get why your kids play games, looking through this guide can help that. And one of the things that I always encourage is ask your kid, I see you play Roblox all the time. Why do you do that? Why are you playing Roblox? And it's probably because their friends are on Roblox and it's a chance for them to socialize, which is
Yes. Yeah, socialize and connect. Because a lot of times I feel like parents or the hospital staff might walk in and just see this kid looking isolated because they're by themselves, maybe the headphones in, and they're just so hyper focused. But like that is their social time. That is their
yeah,
connection time. And it may look like the opposite, like they're super isolated, but they are probably so hyper focused and connected and engaged in a way that they probably have not been in quite some time, especially what you're to get back into what you're saying about the control factor, where if you're in the hospital, you don't decide what you eat, where you eat, how you eat. The lights go out at a certain time. I mean, it's very a structured day, all day for you. And then when you do have that video game, you have the opportunity to actually have some autonomy, which everyone I feel like naturally gravitates the most is freedom and the most autonomy. So when they have that, it's got to be such a really, really good feeling that they can have that. They just don't
yeah.
have.
And we don't get a lot of pushback. The child life department, they love us. We're great. We send them free stuff all the time, right? Who doesn't
Yeah.
love that? But we get a little bit of pushback every now and then from them, sort of like, hey, are kids playing games too much? I don't know about kids playing games, or I'm not a gamer. I don't know that I can engage with a kid that way. And so we always work really hard to remind them a couple key things about games. And one is sometimes that's the only way the kid can stay connected, even if the game's not online. If I'm playing Minecraft and I used to, when I'm home, I'm playing Minecraft online with my friends, but in the hospital, I'm not able to play online. I at least can play Minecraft and feel like I've still got a little bit of normalcy and like, hey, I'm doing this. And I can later talk to my friend about the cool thing I did in Minecraft when we get together again. So there's that social connection. And if they're online with their friends, that's even better, right? You and I playing Minecraft together.
Oh,
Boom,
yeah.
here we go. We just get to talk about what's going on in life, and we get to do that all the time. But if we don't get to, even the next time you and I get together, and you're like, man, I was playing Minecraft and I built this amazing castle. You should have seen it, dude. It was huge. Walk through here, pit traps, like
Yeah.
that still lets them have that connection. But also when you bring in, games like FIFA or Madden or NBA 2Ks, any of those games where a kid who loves soccer but can't leave the hospital to go play soccer, they could be in there completely focused on this game, and you might be thinking like, man, this kid's doing nothing. They're just staring at this screen. But to them, they're on that pitch, they're kicking that ball, they're playing that game that they love, and it helps them have that connection still with what's going on outside. And then to the side, when they say like, we're not gamers, I don't know that I can use this. Like I sort of see the use of these tools, but I don't know. Like I don't play games. We always remind them, sit down and play that game next to the kid anyways. Give them the chance to teach you how to play. You've been taking care of them. You're there to take care of them. Everybody's taking care of them. Let them have this moment to take care of you. And we remind parents too, let this kid sit down and teach you how to play. Be the hero, protect you from the skeleton shooting stuff at you, get in the way of the bad guys, and have that level of like, boom, I'm doing this, I'm helping you. And then when things turn around and you've got to take them in for the blood draw, which is scary and not great, you get to go, hey, you helped me, you were my protector, I got you, I'm bringing you here, I'm going to be your protector. So there's that level that games can bring that is hard to reach otherwise. So
Yeah. No,
we-
you're right. You're right with
we
that.
think they're super important.
Yeah, yeah, you're right with that too. And whenever I play video games around, a generation who didn't grow up with video games like maybe we did, there's always like this little smile and smirk watching it happen, because I feel like it's their maybe their first time like actually watching it and just enjoying, like, and also being sucked into it too. So I mean, if you aren't a video gamer or have never played and you're watching somebody else play it, don't be afraid to jump in, chime in. It doesn't take that long to learn, man, because it's all fun stuff.
Yeah, and gamers love to teach other people about the games they love to play. So
Yeah.
so the guide has been a huge tool. We get a lot of thank yous from the hospital on it. And again, I encourage people to go check out it's gametherapy.org, a chance to flip around on it. And then on the Child's Play website, you can find a downloadable PDF version. So it's, you know, a snapshot photo because we can't keep the PDF updated every single month. But the online version's got an updated list of games every
And
month.
do hospitals are kids allowed to play online at hospitals?
You know, that really varies on the facility. A lot of places have restrictions on their internet access, and it's, you know, lots of different hospital red tape reasons that come up.
Yeah.
Some of them pretty legit, not wanting their records hacked and medical records getting released and things like that, and some of them less so on, you know, at least legit in maybe my eyes. I'm sure budget is a pretty solid legit reason in a hospital, but opening up bandwidth concerns of like, well, if we got to open up more bandwidth, that's going to cost us more money. But we've seen some hospitals that have connected Xboxes in every room, so kids are ready to play. One of the things we haven't even talked about is some game techs that Child's Play have been funding, and I'll spit some more detail on that in a second. But one of our game techs is building a program where actually kids who have been released from the hospital can go online and play games with kids who are still in the hospital, so that like, I've dealt with that same treatment, you've dealt with that same treatment, we can play Minecraft together
Oh, that's
and
cool.
kick it and have a good time. But yeah, one of the we're in a weird situation coming out of COVID here that we saw had to go online to connect now. You know, travel stopped. And so we're really hoping one of the silver linings coming out of COVID is that those people in the decision-making places think more about the importance of when they were connecting with their friends and family virtually, and making that a priority inside the hospital, so that kids who are there have the ability to connect virtually and get online and play with their friends, play with their family who still might be under restrictional visit rules, so that, you know, maybe siblings can't come in, but we can hop online and, you know, you can play with your brother and get that game in.
Yeah, it's good because a lot of hospitals I know are still kind of. I mean, there's some on just such different levels than others right now after COVID, where some still have like a lot of restrictions. Plus, it depends, I'm sure, on like the unit or what's going on and how contagious things are. They
Yeah.
might have extra barriers set up there too. But you know, if I was a if I was a child in the hospital right now, if I could play an on like Call of Duty online or something, oh my gosh, that would make my whole experience there.
Yeah, we're hoping to see a bigger push toward getting everything online and connected. And even if it's not every single room, we're starting to see more, you know, playrooms where there's the designated, this is our online Xbox, you can log into your account, this is our online PlayStation, log in, get your friends list loaded up, connect with your buddies, play your Madden. Okay, log out when you're done. You know, that's one of the big concerns is, hey, what happens when you log in and you leave your PlayStation logged in with your account, and I come in later and I hop on and there's all
Yeah.
your games and all your friends and I'm interacting with them. So there's valid concerns inside the hospital level, but one of the things that we try to do is teach them about, hey, these are the correct procedures. You got to get those, you know, those procedures in place for how do you handle this. And that's one of them, is make sure people log out. Same kind of thing with your, you know, your Netflix in the hotel room, right? You want to make
Yep.
sure you log out of Netflix before you check into your room. And a lot of hotels have it in place where they just sort of reboot that TV and it forgets anything that was there. So you're not using the previous person's Netflix. So coming up with those things that hospitals need to think about that are new in their process that they're not thinking about normal is one of the things that we really try to be a resource for them, so that when they reach out to us and say, we're thinking about this, but that's really scary, and here's the things that scare us, we can go, totally understand, valid fears, here are hospitals who are doing those things, and here's how they've overcome those fears.
So how can people get involved with you guys or kind of stay updated, maybe make a donation? Can people send you guys video games?
Yeah, so our website is childsplaycharity.org. You can reach out there. You can also find on the About Us our, you know, contact page if you want to shoot me an email with even more questions. Happy to chat and answer them. And yeah, we have the ability to get in-kind donations as well. We do, lots of people offer us used systems as they get their PS5 and they're like, we got an old PS4. Those we tend to point people to places like eBay for charity, where they can designate the funds to go to Child's Play, just because infection control at hospitals really a big concern, and so
It's intense, yeah.
they don't want your used Xbox, even though you're probably a perfectly fine and clean person who's got a good Xbox. They're a lot more anxious, understandably, about it. So we point people there for used things, but we have an Amazon wish list you can find on our site. You can find Amazon wish lists to all of our partner hospitals, and find items that they actually want and send them straight to the hospital so they get the stuff. So yeah, lots of different ways to get involved. Definitely, check out the website, make a donation if you're so inclined. That's what keeps us going, is people looking at the work that we're doing and seeing it as important, and really putting the value with their dollars behind it.
No, that's awesome, and thanks for sharing that. I gotta think too. You guys have probably got to be the only nonprofit in the world who has a Twitch account. Do you guys still have that up and going?
We do. There's a bunch of them out there. Lots of places are figuring out. If you look right now, video games are bigger than the movie and the music industry combined in annual revenue. So the video game industry is bigger than movies and music.
Oh, it's booming then.
And so everybody's trying to figure out how do they get their fingers in on those gamer dollars. But one of the things that I don't like to knock any other nonprofit. Everybody's doing great things. But if you are a gamer at heart and you're looking for a charity that reflects the gamer values, this is what Child's Play does. We are gamers who are working to evangelize games inside the hospital space, teach people how to use them in the same way that you probably use them at home yourself, with affecting your mood and helping you feel better and stay connected with friends. And so you'll find lots of gaming charities, or lots of charities now, on a place like Twitch. But they're raising funds for good things, bringing water to people who need water and stuff like that. But they're not bringing games to kids in hospitals. Yeah. So that's always our pitch. We are born from the spite of video games and video gamers, and empowering kids with the power of play.
No, I thought that was so funny when I was like, that just makes sense. I was like, Twitch account, that's what you know what I'm saying? I was like, I love that.
Yeah, we had a good run on Twitch as we were not doing gaming conventions. Now that we're back to gaming conventions, it's a better way for us to connect with people. But we still do put some stuff up on Twitch every now and then, and our YouTube channel's got stuff up there as well, talking about what we did. So yeah, it's really a way for us to share the impact that games have inside the hospital, and the impact that donors to Child's Play have on the life of a kid who's sitting in a hospital, potentially kind of bored and feeling sad. Make that PlayStation appear. Here you go.
Yeah,
feels great.
That's awesome stuff. It's good to hear you guys are doing that. I'm sure Christmas time is gets a little busy for you guys, which is a good thing, and hopefully we'll link up down the road again. Thanks so much, Travis, for coming on and sharing this, because you guys are so unique in this, and I'm finally able to link up nonprofit and gamers and make it all relatable. So I'm so happy to have this. So I appreciate all you do, Travis, and I'm sure we'll see you down the road.
Yeah, thanks again. Thanks so much for introducing us to your audience and sharing what we do. It's through this word of mouth that has kept us going for 19 going on 20 years.
Yes, definitely. And we'll stay in touch.
Sounds good. Thanks so much, man.
Thank you, Travis.